watching KPIX Channel 5. Now, live Eyewitness News at 10.
Later, Dr. Nancy Snyderman will have a report on serious back pain and a promising new way to stop it. Dr. Nancy Snyderman will tell you about a promising new procedure for serious back pain right after this. Most people with back pain can find relief through physical therapy, but the most severe cases may require surgery, and that's not always successful. Tonight, Dr. Nancy Snyderman is on call with the story of a San Francisco doctor who's been having better luck with a new procedure.
Sarah Oppenheimer is the picture of grace and beauty as she practices ballet here at the Lines Dance Company. But just last spring, she had crippling back pain.
It was stiff to the point where I could hardly move. I mean, the pain was so bad in the shoulder area and coming down the arm. I thought, this is not your ordinary, the stiff neck that one would get when you wake up and you sleep the wrong way.
The shoulder pain was a clue that something serious was wrong. Your back is made up of individual bones called vertebrae. Discs separate each of the vertebrae and cushion them. But one of the discs in Sarah's neck was pinched and bulging.
Here's the spinal cord. It's a gray stripe. And here you can see at C6-7, there's a piece of the disc, which is the shock absorber that usually occupies the space between the two vertebrae, pushing back on the spinal cord.
Dr. Light decided to operate. First, he removed the disc.
This is what the disc looks like. It's a little piece of crab meat.
Next, with the disc gone, the two vertebrae needed to be fused together. Often, doctors will simply fill that space with a wedge-shaped graft, but this may not ensure success.
When the patient puts their head back, the graft can extrude forward, and very often the surgeon would have to go back and put the graft in.
So Dr. Light is creating a different size space by drilling into the vertebrae. He's making a trapezoid shape, or keystone as this operation is called.
The wide part of the trapezoid is posterior in the spine. So when you put your head back, the posterior part resists the graft from coming forward. So as a result, we've had no redo operations of the neck in 5 years.
Dr. Light harvests some of the patient's hip bone and shaves it to fit into the spine.
I have the piece of bone, but it provides an immediate lock. Good. Okay, relax. Relax. Very good.
Of course, any surgery has its risks, and this is no exception. The big worry in this operation is any damage to the spinal cord, although that risk is really very small. There are also other nerves in the neck, like the one that goes to the voice box, and doctors take great care to identify those and not to hurt them. Sarah Oppenheimer was back in point shoes 3 weeks after her surgery in March, although she did need to wear a brace that immobilized her neck. Now she's preparing for a week of performances in Spain.
I'm just so happy, I really am. It just improves everything. I mean, I can't imagine living in that kind of pain.
Dr. Nancy Snyderman, Channel 5, Eyewitness News.
Experts stress that most people who have back pain don't need surgery to get better. Other methods, such as physical therapy or weight loss and exercise, can help tremendously. Dr. Snyderman says if you have back pain, talk to your doctor about all your options.